Hello, hello. Okay, so today we are going over another study on Oscillococcinum. A few weeks ago, I did a trial by Papp et al. That looked at whether or not Oscillococcinum treatment reduced the severity and duration of influenza symptoms, and it was a repeat of a trial done by Ferley et al., and that's the one we're going to look at today. So it was originally published in 1989 in the British Journal of Clinical Pharmacology, which is interesting, right? Like a lot of these trials on homeopathic preparations are published only in homeopathy journals. This would make sense. But this actually was in a different one. So I also find it a little interesting because it's an older trial now. So it was 10 years before the Papp et al. Trial. And it's just interesting to see how the conventions in paper writing has changed over time. So if you look at the abstract here, like it's just shorter. It's written a little bit differently. But one of the main things I want to draw attention to, so the Papp et al. Study, you could see quite clearly that the authors were affiliated with Boiron. However, with this study, they don't report any potential conflicts of interest, and I've done a few Google searches, and I can't find whether or not the authors are affiliated with Boiron or not. So Boiron manufactures Oscillococcinum, and so you would expect that a lot of the research has been done by industry, essentially by Boiron, because they're trying to find research to support their product. First clue, it's not actually homeopathy. So I can't find anything with Balducci that says, ooh, interesting shape, that he's affiliated with, or she, they don't get the first name, is affiliated with Boiron, and I can't find anything, that's another interesting shape, that says that Ferley is affiliated with Boiron explicitly. So we don't know where the funding for this trial is coming from. So this trial, like the Papp et al. Study, like I said, it's a repeat. So the methods are very, very similar. It was to assess whether or not Oscillococcinum helped lessen the duration and severity of symptoms in influenza. This is not prophylactic. In other words, it's not preventative. A lot of people take Oscillococcinum as a preventative every year, and so this research won't tell you whether or not that's going to be effective or not. It's going to tell you whether or not it's helpful for treatment. I don't know why, as a human species, we seem to conflate treatment and prevention, but they are different things. So what they had 237 cases, and they had 237 people got treatment, Oscillococcinum, and 241 got placebo. The placebo, you would think, and I think this is true, but they're not super explicit, is that it looks exactly the same, because of course, with homeopathy, you could just take unmedicated pellets and medicated pellets, and they look exactly the same. They don't have any sort of taste difference. They don't need to have any sort of size difference, nothing. And so it should be absolutely impossible to tell the difference. Okay, so we shouldn't have any issues with bias when it comes to placebo versus treatment. In terms of you shouldn't be able to tell whether or not you're getting treatment or placebo. Okay. So the way they measured is, this is during an influenza outbreak, so they didn't take swabs to verify whether or not this was influenza, but because there was an influenza outbreak, they could be pretty sure that if people had the symptoms of influenza, it was most likely influenza that they were suffering from. They measured recovery by looking at rectal temperature twice a day. Poor patients. I don't know why they didn't just do oral temperature. I mean, I know it's slightly less accurate, but it just seems mean. And then they had 5 cardinal symptoms of influenza, which was headache, stiffness, lumbar and articular pain, so back or joint pain, and shivers, along with cough, coryza, runny nose and stuffiness and stuff, and fatigue. So these are, the major symptoms of influenza. If they had these during an influenza outbreak, they probably have influenza, is what they're saying. And they defined recovery as no longer having a fever and complete resolution of the 5 symptoms. So they did all their blinding and stuff, and they did in fact have a favorable outcome for treatment. So within 48 hours of treatment, which is pretty good, 2 days, right, was greater among the active drug group than among the placebo. So P is 0.03. So for it to be statistically significant, the convention is P has to be less than 0.05. So indeed we are in the clear here. This is, I can never say it, statistically significant. So this is interesting. Because I don't know anything about these authors, I don't know if this is because they're publishing in a non-homeopathic journal or if they are in fact sort of more, shall we say, conventionally minded, not homeopaths. I'm not sure. And they do this in their discussion as well, not just in the abstract. The result cannot be explained given our present state of knowledge, but it calls for further rigorously designed clinical trials. They talk a lot about how we don't understand how homeopathy works, but this shows that indeed there is some merit, that this needs to be explained further. And like I said, I don't know if that's because they actually are not fully convinced about the efficacy of highly diluted substances or because it's in a non-homeopathic journal. I don't know. But I always just find it a little curious. So let's look at the results a little bit more in detail. Okay, so here are the more specific details of the recovery within 48 hours. So how we got that P is 0.03. Of the people who got the active drug, 228, 39 had completely recovered within 48 hours. Of the people who got placebo, 234, 24 had completely recovered within 48 hours. And so you've got 17% of the active treatment group recovered within 48 hours and 10% of the placebo group recovered within 48 hours completely. So that is moderately favorable for the treatment group, but we're not talking a massive amount of recovery, right? This is moderately favorable. Okay. Now it gets a little more interesting to me is when you look at sort of the specifics of who got better. So this is called a subgroup analysis. So you look at the age groups within the treatment population and the placebo population and stuff like that. And I should say they did look at what's called baseline characteristics. So they looked at whether or not the treatment and placebo group were different before they even started treatment. So was the age significantly different between the two groups? Was the sex, was there tons of men in one and tons of women in the other and stuff like that? And that's very important because those could all be confounding factors. And there were no significant differences between the two groups. When they looked at age and the severity of illness on presentation to the clinic, they found that the younger people, so 12 to 29, 12 was the youngest that was allowed into the study, so they didn't look at infants and children. They recovered more than the rest on active treatment. So 21 recovered on the active treatment and 6 recovered on placebo. So we're looking at 8% versus 25%, a much larger difference. And you see that reported in the p-value. P is less than 0.01. So it's even more statistically significant. If you look at severity of illness, the people who recovered who had severe influenza, here, was only 7% on active drug 7% on active drug, also known as 7, and 8 on placebo. Ooh, that was a wild line. 8 on placebo, or 8%. So there was no difference. Absolutely no difference, basically, as far as I'm concerned. That's, yeah, no difference. But in the mild to moderate group, 31% on active treatment and 16% on placebo recovered. Sorry, did I say percent? 31 people versus 16 people, or 24% versus 11%. More statistically significant. And here again, you can see p is less than 0.01. So essentially what this is telling us in the subgroup analysis is, like, if you are between 12 and 29 and have a mild flu, you're quite likely to respond to Oscillococcinum, which it's funny, I was talking about this with my husband the other day, and he's like, oh, so if you don't need treatment because you're young and you're not that sick, then it'll work, which is true. And so the last little bit I want to draw your attention to is they have this graph here at the end, and they look at they essentially, because influenza is what is called self-limiting, meaning it does not last forever. The definition of an acute disease, according to Hahnemann and the Organon, is one that eventually kills you or you recover. Like, it doesn't last for 6 months. That's a chronic disease. And in modern parlance, we call it self-limiting. So because influenza is self-limiting, essentially, the longer you look at whether or not people are getting better, you're going to see that people are getting better, right? That's because that's what happens, right? You recover from the flu eventually, or you die. Those are the two options. And so what this graph looks at is, over time, adjusting for the fact that people recover regardless of whether or not you treat them, how many recoveries could we potentially attribute to the drug or the active treatment as time goes on. So in this graph, so this line that I've highlighted in blue here is what they say are attributable to the drug. And as we go across, this is time. So this is day 0, so obviously no recoveries can be attributed to the drug on day 1 or 0, and at day 1 you get a little bit more. And this is percent not recovered. So what that means is, so here we have the active versus placebo. The solid line here is placebo, and the dotted line is active. Now, what you see is the percent not recovered, so 100% are not recovered. 100% have the symptoms on day 0. That's how they got in the trial. And then as time goes on, there's fewer people with symptoms. That's what this is saying, right? And that's exactly what we would expect. And what this is saying is how many of those recoveries are likely due to the drug. So what you can see is there's a spike in recoveries likely attributable to the drug at day 1.5. I think. Yeah, 1.5. Day 1.5, and then at 48 hours, there's a little bit less, and it gets a little bit less as time goes on. So it also seems that if you give Oscillococcinum early, and it's going to work within the first few days, and after that, it's not as likely to be efficacious. Okay. Now there's a large grain of salt to be put there in that look. So these little bars here are called confidence intervals, and the size means there's a lot of variation within the data, which just means it's a little bit hard to tell whether or not this trend is true, for lack of a better word. And so I'm not quite sure how sure we can be with making that claim, but it's, yeah, interesting, I guess. The other thing to look at, so, we talked before about how this was very modest treatment, and you can also see that within the error bars in this chart, in that you can see there's a lot of overlap, which means there's a lot of overlap in the two data sets, the placebo data set and the active treatment data set. And so if this is statistically significant, it is mildly significant, which is indeed what we saw earlier. So as I said before, this is not really it's not not homeopathy at all. It's not treatment based on the law of similar. So really what this study is showing us is that potentially high dilutions have biological action, and that this product has some potential benefit in influenza if you are convinced by the results of the trial. It's the same as any sort of supplement trial or herbal product trial. Like, this is not saying homeopathy works, and it's not even saying isopathic treatment works, because this is not truly isopathic. What Oscillococcinum is a extract from duck liver and heart, I believe, and the person who made it thought that essentially like an influenza virus was in there, and that's why he thought he should try giving it to people with influenza. So it's not actually the influenza virus. This is not isopathic treatment, and it's not homeopathic treatment. It's just a funny diluted product. So you're unlikely to have side effects if you take it. The Papp et al. Study, which was done 10 years after this, did also look at adverse events. This trial, Ferley et al. Says that they did look at adverse events, but they don't report it in the study anywhere. They just sort of mention that they tracked them. Papp et al. Does actually report them, and there was no significant adverse events. So you can be pretty sure this is safe, and if you are young and have mild influenza, this may be beneficial for you, but otherwise it doesn't seem like there's any significant benefit.